Early ambulation is very important following joint replacement surgery. Activity helps prevent surgical complications and is an important part of your recovery. You will be encouraged to start moving your new joint as soon as you're able. Your nurse or physical therapist will help you get in and out of bed to walk and sit up in the chair on the evening of surgery. It's very important that you use the nurse call light to call for assistance whenever getting out of bed. Do not get up alone. You will use an assistive device such as a walker or crutches whenever getting out of bed. Your physical therapist will instruct you on how to use these devices properly. You can expect to be getting up and walking every couple of hours with assistance during the day. Physical therapy will work with you twice a day and help you progress in your rehabilitation. Your therapist will work with you to go up and down stairs, to walk, and to do your exercises. When physical therapy decides you are able to do these tasks safely, you will be ready or cleared to go home. After any surgery, including orthopedic surgery, there is an increased risk of developing a blood clot in your leg. Although the risk is low, it's one that we take very seriously. You will be placed on a medication that will thin your blood so that there is less of a risk for developing a blood clot. There are several options for blood thinning medications. Most patients will go home on aspirin for 4 weeks. If you're already on a blood thinning medication, or if you're at a higher risk for developing a blood clot, your medication plan after surgery may be different. Your surgeon will discuss this with you.